we'll go now to patient counseling. When you say patient counseling, may be defined as providing medication informations orally or in written form to the patients in their representative. So it's not only patients are given informations, but in behalf of the patients, especially patients are suffering for severe illness. So there will be the prescriptions. The one that buys the prescriptions, I mean, are the representatives or the relatives. So the farmers are going to counsel the representative, okay, based on the prescriptions, based on the interpretations also of the prescriptions. So another definitions, providing proper directions of use of the drug. Okay, for example, you take one capsule of this antibiotic 3 times a day for 7 days. So you have to counsel the patients, instruct the patients clearly. Okay, advise the side effects. So if this drug have side effects like allergic reactions or untoward effects, so you have to explain uh, uh, clearly to the representatives or the patients. Storage, so based on the label of drug. Diet, so we have to discuss also the food drug interactions, and of course lifestyle modifications. So example, there are some antibiotics that are have a drug interaction with the alcohol. Okay, this is very important. So like uh, smoking cessation also, it will smoking can also interact, or cigarettes can also interact with the drug medications of the patient. Okay, and next, so when you say counseling, involves one-to-one interaction between the pharmacist and the patient and each caregiver or representative. It is interactive in nature because there is an exchange of ideas also, but more of the ideas and knowledge about the medications are being given by the pharmacist to the patient. Okay, effective counseling should encompass all parameters to make patient really understand his or her disease, medication, and lifestyle modification required. Okay, so you have to give all the parameters of the different drugs that are being taken by the patients, especially if the disease of the patient are considered to be uh, hereditary diseases or severe diseases, or the patient is suffering from hypertensions. Okay, and lifestyle modification, this refers to, of course, if the patients are smokers, so you have to counsel it um, to to do the smoking cessation program. Okay, or to reduce the alcohol intake. Okay, diet is very important also. Okay, next, contents of patient counseling based on the Omnibus Budget Reconciliation Act, United States, 1990. Guidelines specified that the pharmacist should discuss at least the following points while counseling the patients. Name, description of the medications. So my generic name, my brand name. Dosage form, capsules, tablets, or in solution form. Route of administration, orally, rectally, okay, or per oral. Duration of the therapy, so how many days, or 7 days, okay, for 14 days. Special directions and precautions for preparations. So what are the different directions? Okay, so the patient will aim to mix the medicines with water. Okay, and precautions for preparations of the medicines. So administration and use of prescribed drugs by the patients. So how the patients administer the drug. Okay, is that anti-hypertensive drugs have drug interactions with other anti-diabetic drug. Okay, or the common side effects, allergic reactions or drug interactions, I mean. Okay, for administration, so it is based on the uh, instruction of the uh, doctor to the uh, patients. So therapeutic contraindications that may be encountered. So it is contraindicated with pregnancy. Okay, contraindicated with other diseases, including their avoidance actions required if they occur. Okay, so there will be actions if the patient is suffering from hypertension at the same time uh, he or she is taking drugs that are considered to be contraindicated with diabetes, for example, or antibiotics. Techniques of self-monitoring of drug therapy. So, self-monitoring is being given to the patients in order to monitor their own medicine, their own drug therapy. Okay, they can able to do their self monitoring of their illness, blood pressure, okay, monitoring their sugar level if they are suffering from diabetes. This is a technique also. Actions to be taken in case of missed dose. So how the pharmacists give a advice on how the patients can able to do a actions of missing a dose. Mag-double dose ba siya? No. So you have to extend the number of days or duration of drug intake. For example,